Today our topic of discussion is thyroid gland and the diseases related to the thyroid gland. First of all, we will know about thyroid, its anatomy, its position in the body, and its function. Thyroid is an endocrine gland located in the front of neck, also known as anterior triangle of the neck, with a butterfly shape, having two lobes as the wings and an isthmus as the body. Sometimes a pyramidal lobe is also present that attach the thyroid to hyoid bone. Thyroid is located in front of trachea, the first three tracheal rings below cricoid cartilage. Its function is to produce thyroid hormones, also known as thyroxine, T3 and T4, triiodothyronine and tetraiodothyronine. What is the main function except producing these hormones is the production of calcitonin. It regulates the calcium and vitamin D in the body. Thyroid gland is supplied by superior thyroid artery, which is our first branch of facial artery. Inferior thyroid artery, it is a branch of thyroid cervical triangle arising from the first part of subclavian artery. Sometimes another artery, which is known as thyroid artery, that directly originates from the aorta, arch of aorta, or from the brachiocephalic trunk. The main production of TSH that regulates the production of thyroxine T3 and T4. But in turn, the TSH itself depends upon the release of thyroid releasing hormone from hypothalamus. TSH is produced from pituitary gland. We can suffer a lot of symptoms when there is a dysfunction of the production of hormones. The main diseases are hypothyroidism and hyperthyroidism. Hypothyroidism is basically the loss of thyroid function, and hyperthyroidism is excessive production of thyroid hormones. The symptoms of hypothyroidism are laziness, low mood, depression, loss of appetite, excessive sleep, loss of libido, constipation, weight gain, and also loss of hair on the lateral one-third of the eyebrows. People can also suffer from tinnitus and low interest in doing strenuous work. They may have, particularly in the females, menstrual problems. They suffer from polymenorrhea due to uninhibited production of TSH, which affects the production of LH and FSH, luteinizing hormone and follicle stimulating hormone. What are the symptoms of hyperthyroidism? People can suffer from anxiety, palpitations, excessive wish to do work, tremors, irritability, loss of sleep, excessive appetite, loss of weight, sweating, feeling of the warmth. They like cold weather. They hate hotness. So don't get too much hot in front of a hyperthyroid patient, because they may get cold with you. So let's talk about the test, what we have to do to diagnose hyperthyroidism is thyroid function test, including TSH, T3 and T4. A disease which is very common across Pakistan in the border of River Chenab is multinodular goiter. It occurs when there is nodularity in the structure of thyroid gland. It is irreversible. Once it is formed, there is no other way to get rid of these nodules except surgery. So when you feel a nodule or a lump in front of your neck, always consult a general surgeon. So he may get your ultrasound of the neck, palpate, examine. He can proceed to fine respiration cytology and also to thyroid function test and make the diagnosis. We sometimes have to face multiple patients visiting in the OPD with simple swelling that may be from a lymph node, because when there is a nodule in front of the neck, you have to make a differential diagnosis of this nodule and then to make your exact diagnosis, we have to go through a lot of tests and a lot of investigations. Multinodal goiter is basically due to the deficiency of iodine. And these nodules are basically a collection of follicles encased in a fibrous capsule. So the only treatment of the nodular goiter is today is either by radioactive iodine, or the ministry of treatment is total thyroidectomy. People can also perform near total or subtotal thyroidectomy, and once it is in the one lobe, we perform lobectomy and splenectomy. When this nodule is suspicious, when you have to consult the surgeon, always remember, when your nodule or the lump gets increased in size, gets painful, or there is formation of another lump, or your lump has been first mobile and then it has become fixed. First it was soft and now it has become hard on palpation, then you must go to consult a general surgeon. Always be happy and don't be reluctant, don't be shy to consult a doctor or a surgeon as soon as you feel a lump in your body. If you want to make any other question, or if you have any query, I'm always available. Search Surgeon ABC on the YouTube and pass your comment so that I can reply you and you can consult your disease.